I could do
Oh,
it.
right.
Uh, Welcome, everyone. You guys are all muted as you're making your way in. Great to see some familiar names. Awesome. Anyone that's just coming in, you're all muted. Grab a drink, grab some snacks, and we'll rock and roll.
Lunchtime on the East Coast here.
Yep.
We'll lunch and learn.
I know, I didn't even bring a snack. All I got is a drink. So let's keep it moving. It's only water, everyone. Don't worry. Uh,
You
Good to
crack
see you.
yourself up.
I know. I'm loving all the names. I see so many familiar names here. Great to see, quote unquote, see everyone. Anyone just joining, you're all muted as you're coming in here. And we'll get started in just a minute or two. Um, Gonna get the Q&A open and feel free to wave hello, or if you have any questions, we'll dive in. Okay. Looks like things slowed down just a little bit. So since we only have an hour, I don't want to get too comfortable. This isn't our CEU where we have a little more time to spare. So we'll dive right in. Thank you guys all for taking the time to hang out with Britt and myself to go over sideline and return to play, all things post-concussion management with Sway. So as I mentioned before, a few housekeeping items. You're all muted when you guys come in here, and then put all of your questions into the Q&A box on your Zoom webinar. And you have the ability to now like upvote. So if someone asks a question that you have the same question, just hit like the little thumbs up button and I'll make sure that we answer that. And also in the Q&A, feel free to put in some, or Bert, are we doing in the Q&A or the chat? Or
Well,
there is
chat's
no chat.
open as well.
Oh
There is
yeah,
one.
chat's open as well. So I'll keep both open and keep tabs on things, but feel free to put in the chat a profile ID of an injured athlete that you guys want to go through, whether they have a baseline or they don't. We have a few lined up that you guys submitted through the form, so we'll definitely go through some case reviews. And oh yeah, the other housekeeping piece, this webinar will be recorded. We'll post it at some point on our website or on Sway University at a later date. And as usual, you guys can get CEU credits for this. So at the end of this webinar, a survey is going to pop up. If it doesn't pop up, don't worry about it. We're going to send an email, within 15, 20 minutes after, and you'll get an opportunity to complete the survey, and that's how you'll get your certificate. These webinars, these Sway hosted webinars, can be submitted for category D CEUs, and you'll get that certificate once you complete your survey. And from there, I'll hand it over to Britt. We'll dive into all the good stuff.
Perfect. Well, thanks for joining, everybody. Like Kim said, with the uh, with the Q&A and everything, there's obviously a lot of seasoned vets, a lot of seasoned Sway users here. So for sure, if you guys have had some thoughts or things that have worked in the past for you, feel free to comment. We're all here to learn. So, the whole point of today is really to talk about that after baselining. Now we're into the season, those post-injury cases. So, we'll take a look at three position statements that we, certainly here at Sway, and hopefully you all kind of lean on for your concussion management styles. We'll talk about how to use Sway on the sidelines and just some tips and tricks when you're on the sidelines. more of that acute management, and then looking at more of the post concussion management and return to play. We'll be in the slide deck a little bit, but then certainly, thanks for everybody that passed along profile IDs in the forms. We'll dive into those post injury cases and look at some real cases and how others are using it, Sway, and our thoughts on the results and kind of next steps for those cases as well.
Just go into the slideshow mode for that.
Oh, am I not?
I'm seeing like all the different slides.
How about now?
Nope.
That's weird. I'm pressing slideshow. Let me stop and restart. What a rookie. Let's go here.
There we go.
Weird. Okay. So the three position statements that we're kind of leaning on here. We have the CISG. So this is kind of the big papa of the consensus statements. Most recently came out in 2023 is when they put out the actual position statement. And the next one, we're looking at the NCAA provided recommendations from pulling from the CISG, which was updated just after they released this position statement back in September 2023. And then, our governing body as an athletic trainer, the NATA, they had the last position statement was 2014. So, some of us have been athletic trainers since then. The management style has changed a lot based on the most recent research. So they just recently put out the bridge statement back in 2024, referencing the most recent Amsterdam guidelines. And the big changes that we see with this is the whole idea of being proactive with the injury, right? We want to make sure that these athletes are no longer just kind of sitting around waiting for the symptoms to resolve before they really become active. We want to get them back to ADLs. We want to get them back with their teams and doing some exercise. And that really is going to help, reduce those prolonged recoveries and, reduce the risk of it, I should say. And, just making them feel more themselves. They're used to being athletes. They want to be active, right? So with that, just, thinking about the concussion itself, we know this is a multidimensional injury. All three position statements have really pushed to make sure that, when we're evaluating for them, we have to make sure that our approach with this eval is multidimensional as well. So this is referencing two different resources we have for Sway. One geared towards, the collegiate setting, looking at that NCAA checklist and seeing how Sway, fits that criteria of really using Sway on the sidelines and kind of that off-field post-injury management to be, testing the cognitive domains, testing your balance, neurologic signs, especially for on-field assessment, those types of things, as well as our CISG puts out every 4 years, the SCAT-6, which is the most recent acute tool, as well as the SCOAT. The SCOAT 6, we have now the child SCOAT 6 and the CRT, which, are using, the healthcare providers are using. So, this is just a quick overview to make sure that one, you're obviously using a multi-dimensional approach with your sideline eval and that post-management care. But, if you're using Sway, you're kind of hitting all those domains already, which is great. All right. So let's dive into the sideline eval. So before that injury even, happens, we want to make sure that we're kind of setting ourselves up for success, right? So we want to prep. And the first thing you really want to do is how are you using Sway? What protocols are you using? What types of tests are you using on the sideline to, make sure that you're getting the objective measures that you need to make, the clinical decision of not only, hey, is this athlete going back to play or not, or potentially is this athlete concussed or not? From my experience, I certainly say, you do not need to make that diagnosis, especially in your state or your school policies, they might not even allow you to diagnose, but it doesn't have to happen right away. But the reality is you need to get some objective measures. You need to be able to, um, you know, complete your hitting those domains that we talked about, especially the uh, red flags from the SCAT6 and our neurological screenings and our cervical range of motion, all those things. So in the portal, if you don't know this already, you have the ability to customize protocols. So, Sports Plus is the, most commonly used protocol for baseline evaluations as well as post-injury evaluations. But you have the ability to kind of customize that on the sidelines or elsewhere based on what other tools you might be using, as well as what information you need, maybe what information the provider needs. So being able to add, this protocol in the portal, this is a feature that you have to do in the portal first. You're able to add whatever measures you want, between the cognitive modules we have and the MBES. Do you want symptoms tracking to be involved in that? And once it's saved down, you're able to make codes or provide, do a test on an athlete's profile and sway, with that saved protocol. Now, just a reminder what modules are available to you, right? The Sports Plus here on the left-hand side is looking at your symptoms, the most common symptoms for concussion, your MBES, and then the 4 cognitive measures. And then these additional measures, which really play into a part when we're talking about that sideline eval and maybe some post or prolonged concussion management tools, can really play a part in that, customizing a protocol. So the on-field assessment, that is, the first page of the SCAT6, looking at those red flags and kind of higher level primary survey items that us as athletic trainers we're doing, in our sleep. This is like one of the first thing we're taught as athletic trainers, and then you're having this, there's the bomb survey, the sleep survey, and then the 2 mental health surveys, deriving from the Amsterdam guidelines as great measures to use if you're seeing those prolonged cases, just to make sure you're hitting all those domains and treating that athlete appropriately. All right.
And feel free to put in the chat or in the Q&A so everyone can see if you guys have made custom protocols for the sideline. Just in talking to folks, what we've heard along the way is, that acute, sideline, like when you are actually on the sideline, a lot of folks will just administer symptoms and the on-field assessment. Just that on-field portion of the SCAT6, and then later in the locker room or after the game, that's when maybe a screen of the Sports Plus protocol would be administered, which I'm getting ahead of it, but feel free for folks that have been with us for a while, pop that in the chat or the Q&A, like what you guys do. Love to hear from you.
So now when we're on the sideline and we're talking about, what are you going to be using, that injury happens, right? There's 2 directions you can go right off the bat. And it's how you're administering the test, right? What device are you using to administer the test? So the first option I have here is if you, as the athletic trainer, are on the sidelines, you pull up that athlete's profile and you click that big take test option here. All right, so that's making your device the testing device. There's a lot of perks to doing that. One, a lot of times the athletes don't have their phones on there, or they shouldn't, at least on the sidelines, right? It's in the locker room, it's on a team bus or something like that. So this allows you to take a test right on that profile, no code needed. I also find this to be really helpful because when you'll notice, and we'll jump on, in the app here in a second, you're able to see a create event option, right? So that's right there on the test setup page so that you're able to put that athlete in an event. So you're easy to track them, after they leave you and, just in terms of tracking all the tests after that come after this. The second option, just like your baseline testing, is that enter code button, right? So you can create a code on your device, provide that code, and they use their own device to test. Now, there are also perks to doing it that way. So if you create a code, and let's say you plan to use the same protocol later in that management of that injury, if you put the expiration date out, a week, 2 weeks, or so forth, you can reuse that code. So you're kind of checking off another box for something you might have to do later in the injury. That code's already created, so it can be reused after this test. It also has the ability to create notifications on that device or on that code. So when that athlete uses the code, if you have a team physician or maybe someone in admin or PT or somebody that wants to be notified when these injuries occur, it can be you can set up a text. Once that code is used and the test is completed, it's sent to that individual and they're able to quickly jump in and review the results really easily. So kind of there's those two ways, definitely pros and cons to both. But it's kind of thinking about what's easiest for you to be able to review that information as fast as possible after the test and kind of how your workflow is afterwards. As Kim mentioned, right, thinking about the test type, when you're setting up the test, when do we use these two different test types? Now, with baselines, we always recommend assessments. When that checkbox is clicked for a baseline, you're getting a practice test and 2 to 3 trials with that. Versus, now if this is a more acute setting, you're on the sidelines, you're really just trying to get information to decide whether, okay, what are my next steps with this athlete? Are they allowed to go back to play? Do they need to be referred to obviously ED or something more high level? Or are they just going to now filter into my concussion protocol and I'm going to, enable that and go through those steps? So, on the sidelines, I generally recommend the screening. This is the quicker evaluation. You're still able to add each of those modules. So you're getting each, the cognitive and the balance and the symptoms of the different domains of the injury. And it's quick. You've got a lot of things going on the sidelines. Whereas an assessment, you might use more so, later in the injury, when you're looking to make decisions on starting return to play, maybe referral to an outside physician, those types of things, right? So this is just a quick visual, right? This is what that sports plus, if that's the protocol you use on the sideline, of how that would work. No practice tests, athletes jump right into the test versus the base. This says, oh, it should be a check. This is not a baseline. This is a post-injury test, right? This is showing how they're going to get a practice test and then they're doing 3 trials no matter what. So definitely a longer test, 15, closer to the 20 minutes for this type of test. All right. Any questions on that came up, Kim? Did you see?
No, we had a couple of folks want to try the sideline protocol or at least see that on-field assessment more. So I put a group code in the chat where anyone that wants to try it, fill it out for yourself. Code is in the
Perfect.
chat.
There we go. Trial by fire. So this is actually very exciting. We have a couple new resources that Kim put together, just, really just getting information out there and acknowledging, really important, those 3 R's of the injury and of a concussion. So this is just referencing, right, those next steps after you completed a sway test, along with all your other evaluation tools. What constitutes somebody being allowed to go back to play or not. And I know this is not necessarily new for all you, but just to kind of put it on one slide, right? Was there a known mechanism? Are there any red flags? Certainly those are immediate referrals to the ED, right? Neurological signs, again, we're referring for those. Symptoms, there is a ton of research to say, if there are symptoms, there is a mechanism, and there's any deficits in cognitive or balance measures, those individuals there's a high suspicion of a concussion, right? Are there declines on the sway test? You have the ability to test and compare baseline to now this post-injury test where, if you're using scat maybe on the sidelines or post-injury, you don't have a baseline most of the time for that. So you have the ability to compare this athlete to themselves, which is a huge plus. If this athlete is kind of teetering on the lines, right? They're telling you there's no symptoms, there's no glaring decline on that sway baseline, and all these other things are checked off, right? There's no reason why you can't actually do a little exertion on the sidelines, put them through some sport specific exercise without any concern of, them hitting their head again, and seeing if those symptoms then populate. And lastly, the biggest thing, right? Even for us as trained healthcare providers in concussion, there are times where you just can't rule it out. You know there's a mechanism, but things aren't just lining up, and you go with that gut instinct and you just don't let that athlete return to play that day, right? Any questions just with that before we kind of dive into the post concussion management piece of it?
I see a hand raised. Christina, if you're able to type out your question, we're ready for you. I don't know if I can let people talk if that works,
I
but
don't, yeah, I don't think so.
so yeah, Christina, I see your hand raised. Hopefully you can type out the question and maybe we'll answer it in the coming slides.
Yeah, I think also one thing that a question that comes up a lot is like, or how quickly can you administer a sway test? Especially on the sidelines, they're coming off from a game or practice or what have you. So adrenaline's high, just like our baselines. And this is really this goes for any kind of objective testing. You really want the heart rate to come back down to, resting levels before you administer a test. So I always recommend giving 5-10 minutes for the athlete to just grab some water, kind of collect themselves. Obviously you're collecting history as that's going, but allowing that nothing else may mask those signs and symptoms or um, the objective measurement. So I say about 5-10 minutes. That also allows for any symptoms to manifest as well. I think, as we know, those symptoms could come, with a little more of a delay. So giving time before that.
I was slacking on the Q&A. The chat went on top of my window, but there's a great question in there. What kind of test, screening versus assessment would you use for an incident reported after the game? So like if you didn't, I'm assuming this means if you didn't witness it, they come to you at, whatever point. Um, and a lot of it, it depends, right? It depends if they're reporting high symptoms. I would say when in doubt, within the first 48 hours, give them a screen. If it's within 48 hours of the injury, that's the 48 hours is that, recommended relative rest. So the screening is always your safe bet. After that 48-hour mark, depending on how they're doing, that's when an assessment can certainly be administered. But if they're walking into the AT room with a hat and sunglasses and feeling terrible, then maybe an assessment's not the best choice at that, current time. So definitely a little bit nuanced, but
Yeah, exactly. Like, and go by how they're tolerating those ADLs, right? If they're telling you that they're struggling with screen use and those types of things, an assessment's going to be 15 to 20 minutes. So having them on their phone for that long, might not be as positive for them versus, other ways you can collect information, at least for that time. But certainly they have an injury yesterday, coach told you about it, you weren't there, and now they come and they're like, yeah, I'm symptom free, feel great. Have them go through an assessment at that point, right? That's where you're going to collect the most data and then compare to the baseline, with the most information. So kind of talking through, starting to talk through those recommendations for post-injury management. Um, you know, this is where I find that where Sway really shines because of the ability to test when you want, how much you want, right? So if you feel like you need more information, test them. If they're telling you one thing but other things aren't tracking, test them, right? The more information you can gather through that injury process, the more informed you can make those decisions. So just a couple recommendations for the post-injury management: create an event. Really, really important. For not only documentation, you have the ability to create an event report. Those reports can show you start date, end dates for all of the events that you had over a period of time. So if you're reporting those injuries, after a year to your AD or the NCAA or those types of things, really easy way to tease out those injuries over the course of a year. And it's also really helpful when you're providing those clinical reports to show what tests fall within that event for outside providers that may not see inside your sway system. Secondly, set up the profile code, right? Set up a profile code for symptoms only. A lot of you, we've always been doing the symptom checks, daily symptom checks on paper. You have the ability to digitize this and have everything go into one spot in this athlete sway profile. So at the time of injury, create that symptoms only code, provide that to the athlete, give them instruction of when you want them to take that test, and it's literally just, they don't even have to put in their demographics because it's attached to their profile. So it's super fast, easy way for you to just get a timestamp of where those symptoms are each day.
And you're setting on that symptoms only code, you're setting the expiration date. Just set it like a month out. That way for every symptom check-in, they're using that code. You don't have to create any more codes throughout the return to play. Obviously, if you want to do, more testing on the sports plus side, you create a code for that. But your symptom check-ins, one code for their entire, you know, return to play.
Yep, exactly. And as we mentioned earlier, really, if you're making any large decisions, you should be doing a sports plus assessment, or some version of that comprehensive assessment to get as much data as you can to compare to their baselines. Talked about this unlimited testing. So this is just an example of injury happens on Friday. You do a sports plus screen. You give them those symptoms only code to be able to take symptoms the next 3 days. When they check in with you on Tuesday, you're able to do a sports plus screen, and then excuse me, just move through their injury and be able to, each day collect some sort of data for you to progress, regress, refer, those types of things until, they're ready to return. When you do that full sports plus assessment, that's kind of the clearance test. That's kind of up to you based on your protocol, based on providers that when do they want that information. I think that's important, but really we recommend a full sports plus assessment prior to full return to play at the very least.
Awesome. A great quick question that was in the chat. I want to make sure anyone that can't see it can also just hear it. But you can create events at any time. So even if they're cleared, you can go back in and create the event like retrospectively. You can do it from the app or the web portal. And I put a link in the chat to Sway University with the instructions on how to do that. And it's really just
Yeah,
going to
good
make your
point.
life easier at the end of the season. Like you can run an event report and just see all the events that happened over the course of the season. So nice on that
Very
side.
good point. Last bit before we kind of jump into some cases is the return to play considerations. And there's a couple tools for you within Sway that you can use to, give that final check mark on your return to play for an athlete. One is obviously looking at the historical data. So within Sway, you'll see any post-injury tests that has a baseline, these percent differences for MBES, reaction time, impulse control, and memory. And then you'll also see in milliseconds, that I think this is really important, our inspection time. So this is the only one that won't show percent change. It actually shows specifically the millisecond difference for the changes from baseline. All right, so you're able to see that for any post-injury test.
Well, and
We
that's
also,
my favorite view, just another
yeah,
like thing for the events. Like this is my favorite view to see all of your post-injury testing housed in that orange bracket. It just makes it so much easier, especially if another provider is jumping in to either cover or help or things like that. That's always a favorite one.
exactly. And then we have the normative data, right? So you can compare your athletes to their peers, both by age and sex. So you're able to see the gray bar on all the results, right? And you're able to see where that average for the post-injury test is, as well as you'll see if there's the baseline, you're able to see the baseline consistency range as well, even on post-injury tests. And then lastly is our reliable change index, which this is an external document. We'll make sure we share this out if you haven't seen this or maybe forgot where to find it, right? So this is a great way to be able to view the results, especially if you don't have a baseline, or they exceed their baseline measures. We all know those athletes that we've seen that where they're now performing better than their baseline. How to know whether those tests are significantly changing over time. We expect if we look at a test yesterday and a test today, there's going to be some change that's inherent. But is that change significant or not? So looking at these ranges to see, the smaller the range, obviously the more sensitive that range is to say, hey, I need them to fall within a smaller range to say, this test they plateaued within their results, versus, the 90% larger range. So those three tools definitely recommend reviewing, after each test, and then certainly overall once you're ready to return to play. And then following our, the CISG recommendations that also fall along with those other two position statements, you know, making sure those athletes are symptom free before they get to return to step 4. But they can be having a little bit of symptoms, and that's a great way where you're using sway within the first 3 steps, getting them back to some sport specific exercise, and then by step 4 having a post injury sports plus assessment back to within normal limits of their baseline before they get into more of that sport specific in practice um, movements. So this is another poster that was put together. So this is just a great visual to have in your athletic training room, which you guys will get links to be able to download after this event. Just keeping your athletes informed too. They're going to be like, why the heck do I have to wait this many days? And there's science behind it. So referencing that.
We have a good question about the return to play process, and I want to reiterate just what Britt said. This one and the 3R poster before, you guys are all going to get links to it. We'll, do a big announcement at some point, but if you see us at conferences, we'll also have these at tables to hand out. But these are really meant to print out on a, 16 by 20 poster size, like put it on the wall, hopefully educate, coaches, athletes, all of that on what concussion, return to play, and signs and symptoms are meant to be. So super excited and happy to provide these types of resources for you guys. The question in the chat about, or in the Q&A about return to play, if an athlete has a really high symptom score, at what point do you begin the return to play process? And that's definitely a challenging one, but Britt, you take a stab at it.
Yeah, I think, well, one, obviously review their medical history, right? Is there any pre-existing conditions that might put them, in a position to have higher symptoms at baseline? Were their baseline symptoms also, obviously reported? I think that's important. And then using those other tools along with sway, I think can be really helpful kind of managing, are those symptoms really truly from a concussion, or are there other kind of stressors that might be causing that? So putting them in some sub-symptom thresholds, exercise, using the Buffalo concussion treadmill test. I always use that. That's some great research behind that with Dr. Letty. And then, seeing what the heart rate, what is your heart rate? What is their heart rate telling you? At what point are maybe symptoms going up? Potentially, are those symptoms coming down because they are becoming more active and kind of getting back to their normal daily routines? Usually I would see those symptoms come down pretty quickly, which is great, because exercise is medicine in a sense. So, I would really, those first 3 steps, I would go ahead and progress them as long as those activities are not increasing symptoms. That's what the position statements all say. We don't want to see prolonged symptom increase from those activities. So that really is your guide with those higher
Yeah.
symptom threshold ones.
Because really, folks can live in stages in steps 1 and 2 for quite some time. Especially if they have history of concussion or they're potentially falling into that delayed recovery. But step 2 has 2A and 2B. So you can be in light aerobic activity for a couple of days because like your symptoms spike or you're trying to manage X, Y, and Z. But really the rest or the not doing anything until symptoms go down at this point it should be ancient history,
Yeah.
um, because we've just seen there's been such good research out there on the benefits of exercise and early intervention to that exercise. um, so yeah, great question. And we have another question coming in, but Britt, if you want to start to pull up one of our case examples, I can get this one going while we
Yep.
I want to make sure we have a lot of time for cases. And I sent you in our Zoom chat a profile that someone put in. It's injured but no baseline, but maybe we should start with a
Mm,
baseline, then injury, and then whoever submitted that one we'll get to that after. But we have quite a few lined up anyways. Um, this next question is great, talking about daily symptom checks. And the person that put this in, our physician who handles most of our concussions, as well as some research, has heard that daily symptom checks can cause athletes' symptoms to last longer or certainly get hyper focused on that. I've definitely seen that myself, in the clinic. And it really depends, right? I think the daily symptom checks are the most important in that first week or that acute phase. Like you want to know what's happening in those first, 24 to 48 hours. Are they really symptomatic? Is their dizziness super high? What areas of their symptoms are they reporting high numbers on? Because that can really help guide care later on. Certainly, as kids or athletes get further out from their injury date, you might not need the daily symptom check-in. And certainly those that fall into that protracted recovery where they're like really holding on to every single symptom and they're analyzing every single, number that they're feeling. Well, I was this yesterday and then now today I feel this way. Those are the ones that you'll probably back off on and learn what fits their needs the best.
yeah, that's exactly right. Yep. Perfect. All right. So this is one profile that was submitted, a good example of a recent baseline that was completed and an evaluation done, at the time of the injury. So if we look here, you know, best practice is always to review the baseline first, right? Especially if it's been a while since this athlete has been baselined. You just want to make sure that there's nothing glaring that you see on baseline that you want to reference when you're reviewing those post-injury tests, right? So we want to see, consistent scores, obviously, with balance. We're seeing kind of on the lower end of that normative data. Inspection time, we're seeing, definitely lower on the normative data. So that's one I'm going to think, just remember for post-injury review. And then reaction time, impulse control, right? We want to see that range of results, no more than 150 milliseconds, with impulse control being a little bit slower. So we're seeing that nice consistent scores, no errors on the baseline for impulse control, which is great. And then lastly, with memory, right, we're seeing a consistent score, and then 3 out of 3 for the delayed recall letter recall, I should say, on that. So I feel good about this baseline. That post-injury test we can review and see, feel good that it's a good comparison, right? So, firstly, I didn't mention, but symptoms on baseline were 0. So now we're seeing that post-injury, initial onset of symptoms, pretty high physical symptoms here, and then, a decent amount of cognitive symptoms also referenced in here. So this is an example of a post-injury screening, right? So this is on the sideline or, at least pretty soon off because we see the event was started on the same day as this test. So it's a really quick, eval to see what's going on. So right off the bat, balance, off the normative ranges. We see where their baseline ranges are with that green colored bar there. So, well off from their previous test. We're actually seeing some improvement in inspection time, but I remember looking at the baseline, that was a lower scored test for them. So not surprising that, potentially they scored better on that test. And then we see reaction time and impulse control, both of them basically, off the screen for those modules. We're looking at the ranges, the scoring scale here, and the average scores for both, very low on the percentiles of the normative data, right? And we're still seeing, within 100 milliseconds between the difference here. So still related, reaction time slower, their kind of go no go decision. We're not seeing any errors there, but definitely on the slower end. And then memory, roughly about the same. And they were able to recall all three. All right, so that was that post-injury test. So right off the bat, I'm seeing those obviously high symptoms. If there was a mechanism, high suspicion already, but then I'm seeing the balance there. And as an athlete, we need to be able to, they need to be able to control themselves in space. I would easily make the decision along with those other, I generally would use bombs as well on the sidelines, which you can document within Sway. I would feel pretty good about holding this athlete out and looking to reassess the next day. Right. And that's exactly what this athletic trainer did on 8:30. They came back, reassessed, right? And we already see improvement in symptoms, which is great. Still, the physical and cognitive domains of that injury are ones that were affected prior to and are still complained of. Balance, improvement, right? It's actually an improvement, showing an improvement from baseline. Definitely above where it was on that previous test. Inspection time lower than the last post-injury test, and kind of creeping back down towards where the baseline is. Huge improvement in reaction time. Now we're within 10% of that previous or of baseline, and back on the normative data scale. But impulse control, that go no go decision, this athlete is still struggling with making a decision on whether they should react to the screen, like that green check mark or red X, and taking a lot of time to deliberate with that. So that's definitely something that I'm going to reference and review. And then memory, a little slower than the last previous test, but within normal limits of that previous from baseline. So you're able to bounce through each individual test there, and then you're able to kind of see these other views here, right? And Kim mentioned it earlier, this test history portion. This is a really great way to just see that high level, looking at the averages of all the modules that were tested with, and quickly see the percent changes and kind of the red or amber or gray flagged results, which is based on the percent changes. And you're also able to see where that event had started and kind of encompass those post-injury tests, right?
Yeah, I know I said already, but this is definitely one of my favorite views. Something to remember when you're looking at this view, all the numbers that are, the score for each module, it is showing the average. So
Yep.
luckily these two right now are screens. So it's only one trial. But when you start to get assessments in here, you have to remember that it is the average of those three scores of the three trials, and same for the baseline. So this kid's average balance on baseline was a 68, but Bert, if you go back to the overview and we look, at the baseline, go to the and Britt said this too, but always when you're dealing with any post-injury cases, review the baseline first. Whether you did the baseline yourself, you probably don't remember that kid from the 300 something athletes that you baselined. Always go back in and look at the baseline. And this kid, even though their baseline average is a 69, they did really poor on single leg, eyes closed left. So in my head on post injury, because of that kid's baseline, I'm going to expect a higher score. So sorry, Britt, just go back to the baseline. their baseline trial 2 was a 73. Like I would expect this kid on a return to play to be closer towards the 73, maybe even outperform his baseline at some point. And same thing like with this kid's baseline, the inspection time, we already know it's going to be way higher than, maybe not way higher, but I would expect, this is such a low baseline, I would expect on post injury that he's going to outperform that at some point. So for whoever submitted this profile, thank you. It's a great one. Um, and at some point, you're going to want to administer an assessment. So we have two
Yep.
screens. The symptoms are trending down, which is great. So at some point, we want to administer a full assessment and see where they're at directly compared to baseline. Um, and sorry, I'm getting caught up in all this. Here's a great Q&A, which if we go back to that first post-injury test, let's go back to that, say this is on the sideline and the kid, the parent's like, well, why can't they go back in? We have a question of how do you explain the normative data or even any of this to a kid or a parent? So I would basically just say, hey, look, this little black number, this 44 here, this is where you scored today. This gray bar is where the rest of your peers scored. That little green one is where you were on baseline. You're off the charts low. We want you to feel better and perform better in order to get back into the game. You know, this is the reality of it. You're 36% off of your baseline. So that's kind of the answer to that one. Um, oh, and then we do have a question. We won't spend too much time on it about the baselines because we hosted some baseline webinars earlier this month, and I want to get to more post-injury cases. But Julia, you asked a question about uh, not all baselines are green. That's okay. Red doesn't mean bad. It just means there was inconsistency between trials. So again, this is why on post-injuries, we review the baseline first. If there's a particular module that's coming up red, you can look at it then. Maybe just trial 1 was terrible and you take it out and you're using the 2 good trials to compare to baseline. Or maybe it's a totally, that module is just not even helpful. You're going to still test them post injury and you'll, use our normative data to help figure out what that plateau is going to be. We'll get to some of that.
Awesome. Let
Yeah,
me
I'll keep
jump
working my
into.
way through this. We'll pull up another post injury here. Here's a question. If you have an athlete that is immediately unable to take a sideline test because light bothers them or whatever reason, do you wait a few days to try to get that initial test from them still? That kind of goes to the, use your judgment within the first 48 hours. When you use a screen, like you do the screen on Sway, it takes less than 5 minutes. And we know from any of the studies that have looked at screen time with student athletes, no one actually like omits all screen time. Like even the control group that was supposed to, for this one particular study that I can never get out of my head because it's kind of funny, it shows how addicted we are to our phones. But like the group that was not supposed to be on their phone was still on their phone for an average of like 45 minutes a day. And that was like the no screen group. So a 5-minute screen, even if their light bothers them and they're a little bit symptomatic, it shouldn't be the end of the world, but you use your judgment within the first 48 hours.
Yep. Perfect. So this is a good example. Another one submitted, looking at um, an injury that happened the day before. And then I'm assuming the athlete came, this happens all the time, right? The athlete comes the next day and was like, I didn't really think of anything, think anything of it, but I was in class today and felt pretty crummy. So first, initially go to the baseline real quick. This is a good example of scored really high on the balance. Sometimes when you see those higher scores in the baseline, there can be concern of can this athlete replicate it on post injury. So, being mindful and remembering like balance for this case, this athlete scored pretty high on that. Inspection time, kind of lower, average, consistent scores. Reaction time, this is a good example of, potentially could there be a low outlier that's pulling this average on the baseline down, which is going to change how those comparisons look on post-injury because it's taking all the averages, so this caret right here, and going to compare those post-injury tests too. So, this athlete or this athletic trainer didn't take it out, which is totally fine, right? If you feel like that average is a good representation of that athlete, you don't need to. Looking at just the score range, we see 214, which is here, uh 239, which is kind of right in here, and then we have the 312, which is, pretty close to the end of the normative data, or down around the 10 percentile, I should say. So, you could potentially, on review real quick, remove that before you start reviewing the post-injury tests.
Yeah.
Impulse
And
con-
even in your head, like on that red one, you just know that you're going to be aiming for that 214 milliseconds. Like you want them to be closer to
yeah.
that range than you do the others.
Yep. And that's another reason you're seeing kind of a larger range in between these impulse control and reaction time, but it could be that test too there. And then, impulse control, lower end of the normative data, but consistent. And then for memory, they did do some other of our cognitive measures, but we'll stick to the Sports Plus. Memory, consistent, kind of higher average. So then we go into our scroll up here, known symptoms here. This is the day after the injury, but high, large headache, pressure in the head. This is the day after the injury. Now they're complaining of some trouble sleeping, you know, so that's definitely something to monitor if this athlete goes into the protocol. Um, we're seeing a flagged result here on balance. Remember, anybody that scores below 90 points on feet together is going to be flagged there. Really more so to pay attention to on the baseline, but certainly it will still show up here on this post-injury test. But we're seeing, decreased in balance, over 20%. Really, really big significant change on inspection time, off the scale here, change 119 milliseconds. Same thing with reaction time. Again, we're seeing that kind of the baseline consistency score isn't great here, but we were shooting for, what was it, 214, 217 or something, so we're
Mhm.
well off of that, 99% lower. Whereas impulse control, there was an error, but not seeing that same relationship on reaction time of being slower. And then memory, only was able to get two working memory, and then only was able to recall one letter out of the three for the delayed piece of it. So this athlete certainly, as you can see, was held out, went into the protocol, and this is a good example of those daily symptoms that were done each day. We're seeing the symptoms originally around 19, a lot of physical and sleep disturbances, which still maintains like the pattern here. Still seeing trouble sleeping. So this could be where you use that sleep survey that we have to potentially, just monitoring that if that continued. And now by the 27th, those symptoms have really subsided, which is great. Now, this athletic trainer performed a screening on 9/28. This could be a great opportunity to actually do an assessment, right? Since those symptoms are coming back down to baseline. So this 9/28, we could make an argument that could have been an assessment to get more data and compare to baseline. Um, Still seeing some delayed in balance, and I'm going to go to the test history view here just to be able to show those at from that high level, right? But much improvement from that first test. And then that 9/29, get the all zeros, which is great for on the symptom side of things. So this is as of yesterday. So, if the athletic trainer is here on the webinar here, definitely good idea at this point to administer a baseline assessment, not only to compare to baseline, but look at those normative data, or sorry, the reliable change from, this is where you can look at the changes over time and seeing are the changes that you're seeing significant or not. So you're using the percent changes that you see in sway and then the ranges here in the normative data, which can be really helpful to see what those next steps are for that athlete. Oh, where'd it go? There we go. All right. Any questions that have popped up, Kim? I can
No, we're
jump to the,
doing good so far. I sent you that profile ID of
yeah,
a
jump
injured
that.
athlete with no baseline. So that's a
Yep.
good scenario.
Yep. No, I'm
We
gonna
got
pull
some
that up.
hands raised. Hey, Christina, are you able to ask type your question? Let's see what happens with this. Oh, oh, wait a minute. Hold on. Here, Christina. I just
Oh,
allowed you to talk. I didn't know I could do this.
put her on the spot. What if she didn't want
I
to be
know.
on
Hey,
there?
she raised her hand. Christina, if you're able to unmute, ask your questions. The stage is yours. I had no idea I could do this. If not, we're going to carry on. All right, Christina, we'll touch base after. Bye.
All right. So this is a good example of, an athlete that very recent test does not have a baseline, right? This happens all the time, unfortunately. So then we're going to lean more so on, the symptom, the history intake that you're taking. Was there a mechanism known? And then where do they fall compared to their peers? And so, you know, we don't know this athlete off the bat, but, high symptom, input here, all four of the physical, emotional, cognitive, and sleep domains. So definitely high suspicion right off the bat. Nobody should be feeling this way, concussed or not, and be performing in a sport, without being, touching base with them for sure. We're looking at the balance here. So we're still, even though we're not seeing that colored bar, which would be a baseline consistency score, we're still seeing that normative data, right? And so this athlete, we're looking at the average here, which is very low on the scale. Looking at that's taking the composite scores for all three of these. Really struggled on the single leg stances across the board for right leg. Definitely lower on this on the score for the left leg, that flagged even on the eyes closed, feet together stance. Test two struggled with that. So definitely low scores on balance. This is a great example, using that normative data as a resource, right? Again, first percentile, meaning the lowest on the normative data for this individual. Pretty consistent scores too, right? So they're consistently scoring poorly on this. Same with reaction time and impulse control, right? Huge gap between the two, meaning they're taking a long time to make a decision, right? They're making errors when deciding when to move that device or not. And then for memory, across the board, struggled with the delayed portion of it. You know, Even on this test one, wasn't able to recall one of the patterns for this individual. So, there were a lot of cognitive symptoms that were scored by this individual. So, makes sense why we're seeing that. So, definitely somebody that I would put in the protocol. Obviously, keep a close eye on, and you know, interested to see kind of that next test, because the next test and the test afterwards is where you can jump in and take a look at the normative data or the reliable change and use that to see, okay, test to test, is this change reliable? Is it significant or not? As well as comparing to the normative data.
Yeah, this is a really good segue. Also, a question that is in the chat, and probably even we'll use it on our next if we can sneak. It's already like basically time. Britt, just click on the profile ID that I sent in our
Oh,
chat. There's one more that has a bunch of post-injury tests over quite some period of time. But that reliable change data that was held up there for the scenarios where you don't have a baseline, or potentially a scenario like this where there's some up and down, or they scored really low on a baseline, or they're having trouble getting back to the baseline. That reliable change can show you, how much change from test to test is actually meaningful. So the question in the chat is, any concerns with administering a full assessment back to back days, or would you recommend a day or two in between? First, I hate saying this, but it really depends. Like that's always the the answer when it comes to concussion. Are they symptomatic? Are they making their way through this, return to play steps? Are there certain modules that they haven't passed? And this is where, again, that reliable change can come into play. If my balance fluctuates just 2 or 3 points, that's not meaningful. If it was, 82 out of 100 today and tomorrow it's an 83, that's not really meaningful. But if I have a bigger jump, and that's where you refer to the data for, then maybe that is still meaningful. And we're gonna see where that plateau is. So
Yeah.
hopefully that answered your question. But yeah, this is a great, lots of symptoms. This would be like a picture perfect one if we had an event created, that nice little orange bracket.
Oh, yeah.
But thank you for submitting this. This is good to see. And now remember, this is a case where these are all assessments. So we're seeing the averages. So definitely important to, check in on the overview, like the very last one, the 929 that was done. Their memory was the module that was flagging low. But I would be interested to see, like, did they mess up on one? Why? Yeah, so that 47 is dragging them down. We did have kind of a couple of questions on um, remote versus in-person testing, and from a sway standpoint, we always recommend in-person testing, especially when making return to play decisions. You want to monitor that exam. If maybe on this one, like if trial one, someone walked in and they got distracted or they messed up, like that's a scenario where I would feel comfortable taking out trial one. And I can document, we didn't talk about this, but scroll up on any test, any sway test, baseline or post injury, you can write in the notes section, you know, anything. On the sideline, you could say, write up other injuries that happened, whether there was a sprained ankle along with the concussion, or on this one, I might write, removed trial one from the memory module because of X, Y, and Z. So there's plenty of space for documentation here as well. Um, and I know we're really pushing the time here. Maybe we need to make these longer. I feel like we could just keep going. Um, but any other burning questions from people? No, speak now or forever hold your peace. Christina, I'm gonna write your name down and I'll shoot you an email because I know you raised your hand a bunch of times. So sorry we couldn't make that work. Uh,
Oh, also with the events here, um, Kim mentioned the note at the top of the test. You also have the ability to add notes in the event as well, which shows up on if we were to create a clinical report. So that's another place to put, specifics that was taken, especially on the at the time of the when the event started, just quick return to play steps. You can add those in to keep your documentation all together, and then it shows up when you do an export events report, looking at that overview of all of your injuries over the date range, which is really nice to see that comprehensive timeline.
Um, here's a quick question. Do you think there's some factor that, practice makes them more able to pass when they're really not ready? So, at least I'm wondering if you mean like the practice trial. Um, but that practice trial is built into the baseline, and the practice trial is not counted towards any of their scores, just the three trials. Oh, testing
Yeah,
day
like
after day.
back to back.
Sorry. Yeah, I misinterpreted it. Yeah. There can certainly be a learning effect to it if you test too closely together. Again, it really depends on, you know, what your rationale is for frequency of testing. If they need to, you know, pass the test to go to stage 4 of the return to play, then that might look like 2 assessments 2 days in a row. It really depends. Yeah, great question. So everyone keep an eye out for your email after this. The survey is going to pop up if you have allowed pop-ups from Zoom webinars, but we will send out an email with the survey to complete your CEU credits. Hopefully everyone knows you can reach us anytime, support@swaymedical.com, or by phone. It's almost always Britt, myself, or our colleague Sarah who are here to help you. And yeah, go print out your return to play and sway posters. I hope it makes it to all the AT rooms across the country. Yay. Bye guys.
Awesome. Thanks, everybody.